Good morning, everybody. Welcome to your open enrollment video. I wish everybody a Merry Christmas and a Happy New Year. I'm here to present for you your 2022 employee benefits. I want to start by saying that I've got good news in that the plans will remain the same. We've made the decision to renew with United Healthcare on their All Savers program. This is big news because it's been a tough year for 2021. A lot of companies have reduced benefits, passed along premiums to the employees, and I'm happy to announce that Bob's Metals made the decision to keep the same benefits and also to continue to pay 100% of the base plan. So hopefully you feel appreciative of this because that is a big thing in this time. So I'm going to be sharing my screen here. I'm going to quickly review the benefits because everything is staying as is. So this is only going to be about a 10 to 15 minute video, but I hope you find it helpful. As a reminder, this is the time to make changes. If you need to add or delete dependents, this is the time to do that. Also, if you want to change plans between the base and the buy-up, this is the time to do that. If you want to enroll on dental or vision, this is also the time to make those changes. So as I mentioned, good news, we're renewing with the same medical plans, and I will quickly review these. We've got a base and a buy-up plan, and then we're also renewing dental and vision with Beam. As a reminder, we have one of the biggest networks with United Healthcare. You have access to a network across the United States. Here it shows you the number of hospitals in the area, number of physicians. And so we just have one of the biggest networks available to us. There should be no reason to go out of network. I will show you that if you do, the benefits are much less. So make sure you're checking to make sure your provider is in the network. Also, I just want to review quickly, we are on a plan that does look at the claims experience for the company. And so the decisions that you make can greatly affect everybody and the renewals that we get from United Healthcare. And so this is just a moment to remind you to be a wise consumer. The first thing is to do your preventive checkups. This is 100% covered. There's no copay. You're allowed one a year. You can even get a preventive colonoscopy if you're at that point in your age. So we encourage this. This will avoid the future catastrophic claims. It has been proven the more preventive care exams that are done, the better a utilization of a group in the long term. I've already talked about in-network. It does save you a lot of money going in-network. It also saves the company. I will also just hit here that not all providers are equally priced. For example, going to a Providence or an OHSU is going to be much more expensive than a Legacy or Peace Health. So, do some shopping. Find out where you can get your procedure at the lowest cost. It has been proven too, just because it's the lowest cost doesn't mean it's the lowest quality. At times you will see that you will get the best quality at a more affordable price. And then also a really big indicator of claims is when we overuse emergency room. Statistically, 95% of emergency rooms could have been handled in an urgent care. This will save you a lot of money, a lot of time, and again, it'll save the company money if you use urgent care. So a review of the benefits on the two plans. And because, again, everything's staying the same, I'm going to kind of go through these a little bit quicker. First, I just want to, again, good news, it's 100% paid on the base plan. There is no cost to you as the employee. These are the costs if you want to add dependents. And then this plan is a $5,000 individual deductible, $10,000 family. And then your out of pocket, which is your worst case scenario for the year that you would have to pay. And again, this does include the deductible portion, is 7,900 for an individual and 15,800 for a family. And I will explain here in a minute what is subject to deductible. First, if you want to go to a primary care physician, it's only a $25 copay. If you do need to see a specialist, you're going to pay a $75 copay. Telemedicine is one we really encourage because it's no cost to you. And there you can have a lot of things handled virtually. They can even prescribe certain medications. So for convenience, it's a great way to go, but also for cost. Urgent care is a $50 copay, much more affordable than if you were to use emergency room. Emergency room is a $300 copay. Then you're also going to pay 20% of the bill after you satisfy the deductible. So if you haven't hit the deductible, you're almost going to pay the full amount of the ER. That's why urgent care is a good way to go. Again, if it's life-threatening, please go to the emergency room. Inpatient or outpatient hospital services is a 20% after you've hit the deductible. So if you're going to have a procedure that costs $4,000 at an outpatient service, you're going to pay that full $4,000 until you've hit the deductible. If you have a surgery that's going to cost $20,000, you're going to pay up to the out-of-pocket max of $7,900, and then you're covered 100% after that. Basic lab and x-ray is subject to deductible, so you're paying the full amount until you've hit that. This is definitely where you want to price it around. If you were to have an MRI at a Providence, you're probably going to pay about $2,000. If you have it at an Epic Imaging, you're probably going to pay around $700. And you have the right to choose where you have your x-ray. I know that sometimes we're at a facility and it's convenient to walk down the hall, but you have the right to say, you know what, I have to pay everything up to my deductible. I would prefer to go more to an independent and pay less. Same with advanced imaging like an MRI or CAT scan. You pay the full amount until you've hit that deductible. Alternative care, acupuncture is a $25 copay, 10 visit maximum each year. Chiropractic, $25, 20 visits maximum. And then the prescriptions have kind of a 4-tier structure. It also kind of depends on what the cost of the drug is, on what your copay could be. Most generics will be $15, but some brands will be $35, usually ones that have been around a while. The newer ones advertised high costs are probably going to run you $75. And then the $250 copay is usually going to be your specialty pharmacy injections and infusions. Now over to the buy-up plan. This here shows you the cost if you wish to buy up. And then, of course, your dependent costs as well. This is a very rich plan. It's one of the better plans that we see in the market. Very low deductible of $1,000 for the individual and then $2,000 for family. And then the out-of-pocket is extremely reasonable at $3,500. Again, that includes the deductible of $1,000 and then $7,000 for family, which includes the deductible of $2,000. This is a plan that if you think you're going to have a lot of costs, procedures, routine care for a chronic condition, it might be worth for you to buy up to this plan. It's a $25 copay too for a primary care physician and $75 for specialists. Telemedicine is also covered at 100%. Urgent care at $50. Inpatient, outpatient is the 20% after deductible, but of course you're paying a much lower deductible amount. ER is the same, so we really encourage that urgent care. Basic lab and x-ray is also subject to the deductible, but much lower deductible as mentioned. Acupuncture is the same as the prior plan, and so are the prescriptions. Okay, so those are the review of the two plans. Now into the dental. We have two plans as well. We have a low plan, which is a low cost plan, but actually has a very good benefit. Again, the company's paying 100% for the employee on this plan. Very generous. It's a $75 deductible for the individual, $225 for family. But you have a benefit maximum of $3,000. This is a very high benefit maximum, more than we see normally with companies. If you're going in for just routine preventive cleanings, you're not going to pay anything. It's going to cost you $0, and it's not subject to deductible. If you go in for fillings, you're going to pay 20% after you've hit the 75. And then if you're getting major services like crowns, root canals, that type of thing, you're going to pay 50% after you've met the deductible. Also on this plan is if you have dependents who need braces, and it is for only children, I believe under the age of 18, you are covered 50% on this and up to a $1,500 lifetime max. This is a really nice benefit. I've got 4 kids that have had braces, and boy, I appreciated having some type of orthodontia service. Then we have a higher cost plan that maybe has a little bit better benefit on the co-insurance. As you can see the cost here, the deductible is lower, but your benefit maximum is only $1,000. If you don't think you're going to use more than $1,000 and you want a higher coverage on basic, then this could be a good way to go. You're covered at 90% after you hit the deductible instead of 80. The major is the same at 50, and it does not include orthodontia. Now the vision plan that's also staying the same with Beam. This is a very low cost premium to you. Again, 100% paid by the company. Just again, kudos for paying medical, dental, and vision. Dependents, here are the charges there. You have a $10 exam on $10 copay on the exam, covered in full after that, and you get it every 12 months. Just as a reminder, it's not a calendar year benefit. So if you go in March, you have to wait until the following March to get another eye exam. Same with frames and lenses. You have a copay there of $10 and up to a $200 allowance, and it's every 12 months. So if you had in March your glasses or contacts filled, you'd have to wait until the following March. One thing to point out here, again, not all providers are equal in price. Optometrists are going to be much more expensive, not only the exam, but also the materials. You may have a balance bill issue. What happens is they reimburse based on the average of all of the vision providers. And so if you go to an expensive optometrist, you could see a balance bill. Also with materials, you're going to have $200 go way more at a Costco or Walmart than you would at an optometry shop. Just a couple resources for you and your family to navigate through the benefits. The first, as I had said, virtual visits are at no cost, and it's a 24/7 situation. It's just a great tool for you to have. I would download the app called Healthiest You, and there Teladoc will be providing the virtual providers. Now, this is a pool of providers, so keep in mind you're not going to have your normal primary care physician. But if you're comfortable with a random provider who also, again, can prescribe, great way to go for you. If you have kids, I've used it for ankle sprains. I saved a lot of money. Instead of running to the ER or urgent care, I had a doctor look at it virtually. He prescribed icing and, the normal things there, and saved quite a bit of money. There's also just things there. You can get a second opinion if you've been diagnosed. Get a virtual second opinion. It's no cost to you. chronic conditions, that type of thing. These are specialists as well that you have access to through Healthiest You. And then also on counseling, I think all of us in the past year and a half need some mental health counseling. So if you're feeling stressed, overwhelmed, feel free to tap into the service that you have. Another thing that I encourage you to do is download the app GoodRx. This is a great tool to have where you can price your prescriptions. In the app, you can put in your medication, the dosage, and then it'll come up with a pharmacy in your area where it's the lowest cost. You're going to find it's usually going to be a Safeway, a Fred Meyer's, a Walmart. It's not going to be your Walgreens or your Rite Aid or CVS. Those are higher end pharmacies that have a lot of hidden fees, middle costs there that make the prescriptions more. Safeway, Fred Meyer's have it a lower cost. It'll show you exactly what you'll pay. It provides a discount card for you to show the pharmacy. I do want, though, to make sure you understand if you use GoodRx, it will not go towards your deductible or out of pocket because you're not using the insurance and it's not billing United Healthcare. Now, United Healthcare does have discounts built with the pharmacies, but personally, over the years, I've shopped both and I have seen GoodRx beat the insurance cost maybe between 30 to 40% of the time. Just remember, it doesn't go towards your out-of-pocket max. Just as a reminder to make sure that you have the resources available for you. It's really hard in the benefits world to navigate. And so having the information is key to you to being able to keep costs down. So please go into myallsaversconnect.com and register. You're going to be able to access your explanation of benefits. This is where it determines what you owe. So if you haven't hit your deductible, you want to see that the discounts have been applied by United Healthcare and then what your portion is. You can also see your claims, how much has been hit towards the deductible. You can print off ID cards and much more. I know it does take some time, but boy, it's worth it in the long run. Also, there's some nice resources that have been provided by United Healthcare. United Healthcare is one of the biggest carriers in the United States, and so they've partnered with other vendors to help you. One of them is Rally. This gives you some partners on fitness clubs, daily healthy activities that you can participate in, just a lot of education and challenges there that will help you in your overall well-being. The other thing too, I want to remind, and you will get a flyer in an e-packet, and as a reminder, you're going to get all of this in an e-packet, the cost sheet. So this will be at your fingertips to be able to review. But this flyer is important for you because United Healthcare has a program called the Motion, and they are, they take it seriously on our health. They want us to be healthy, and they're backing it up by money. If you do certain activities that they've laid out, you can get up to $1,000 towards your deductible. And that goes a long way. So look at it, register. They even give you a $55 credit for registering, and you can use that to purchase an activity tracker that will allow you to participate in these activities. And if you hit like a certain amount of steps throughout the week, that type of thing, you could get up to $1,000 towards your deductible. So that was a quick review. I hope you found it helpful to you in navigating through your benefits. Again, we want to thank Bob's Metals for stepping up, renewing as is, and continuing to pay 100% of the employee costs. And I wish you a Merry Christmas and a Happy New Year.